Thanks very much, and thanks ever so much for inviting me along today. It's really nice to see lots of different people, and I really want to make sure we have time for questions because I think that's probably one of the most helpful things we can do with the time. So Helen's absolutely right. Recent weeks have been a very changing picture. Coming out of the firmest lockdown period, through July, we were, for Stockport, we were seeing relatively low levels, relatively low case numbers. Through August, we had more of a rise again, which seemed to start declining. But in the most recent week, or getting on for two, we have really seen a rise again. So as of yesterday, our rate is in the mid-40s per 100,000 and rising. And across Greater Manchester, across the northwest, that's a very similar picture, albeit there's a lot of people starting at a much higher point than we are. Across the northeast, across Yorkshire, across the West Midlands, they're also seeing quite a similar picture. So there really does seem to be, not unexpectedly, a rise, a dramatic and exponential rise across areas, predominantly driven by the cities, as you can expect, where more people are coming together. Respiratory illness does really well. So that is the picture. It's not, unfortunately, I'm I suppose the bearer of bad news in many ways this morning, that is not what we want to be seeing, and that certainly isn't sustainable going forward. There will be further action required to help us manage that. The question I often get asked is, oh, aren't we just testing more? So if I cover off testing, if you ask me 2 weeks ago, testing was going pretty well in that we had a good supply of testing. We could get people with symptoms tested pretty easily. We were in the position of trying to expand that so that there was more local testing available. More recently, you'll all probably be aware that there are huge national issues with the capacity, which is causing real problems for us. In terms of our testing and the positivity rate, that has also increased with the increase in case numbers. So that indicates that that rise is true and not as a result of increased testing. And actually, since about, with a bit of ebb and flow, since through July and August, our testing rates have been not static. They definitely have fluctuated, but they have not been dramatically different to the rest of the northwest picture. And actually, at the moment, we're slightly under the number of tests per 100,000 people that the northwest. But that, as I say, that ebb and flows a little bit. The testing issues are a real problem for the contact tracing system, because the whole premise is that you get somebody tested quickly, you know their results quickly, and that you can find out who they have been in touch with in the last 2 days, or 7 days going forward from when their symptoms started, and get those people who they have been close contacts with into isolation. And by getting those people, their contacts, into isolation, you break the chain of transmission, because those people have been exposed, they may be incubating the virus, and you want to get them into isolation prior to becoming infectious. And so that all has to happen really, really quickly to get those people isolated before they're then spreading it. And you can see how the spread happens. The process of contact tracing is to get those people isolated to try and break that chain of onward transmission. So the testing challenges do have knock-on impacts for then the contact tracing service and how well that can operate. Across Stockport, just to give you a bit more of a picture of the sort of demographics and geography of what we're seeing. In the first few weeks of as things started to rise, we definitely saw that was driven by a kind of younger adult age group. However, in the most recent rises and in the most recent weeks, that really has spread across the age ranges. I'd say it's still predominantly younger adults and sort of working age adults, but we definitely have seen that spread of ages who our cases are starting to grow. We see cases all across Stockport. There are some areas that are slightly higher, some areas that are slightly lower, but we haven't seen some of the real hotspots, the real clustering that has been seen in other areas. There is a spread. I think 20 of our 21 wards had cases in the last week. As I say, some areas slightly higher, some areas slightly lower, but not a kind of a real hotspot like we have seen in other areas. In terms of the kind of health impacts and the hospitalisations and that side of things, we haven't seen an increase there as yet in Stockport. However, other areas across the northwest where their rates are much higher than ours have started to see that impact. We have also started to see some increase in early indicators, so 111 triages and some of the demand on primary care, for example. But it's still not at a significantly high, but we're just concerned about seeing what's happening in other areas and what may be to come. And I think we've all of us have seen and learned how quickly things take off when you're seeing that exponential growth. So yeah, sorry, not the most exciting or pleasant start to the morning, but really would like to take questions so we can discuss a bit further. Thanks.
Thanks for Jen.
Hi Jen, it's Carl from Allied Bakeries. How are you?
I'm well, thank you.
Good,
yeah,
good. I've got quite a few questions, so if I hog you too long, then everybody else can jump in and say, get off. So I'm quite comfortable with that. So we've got a range of controls from sort of the 2 metre social distancing, lots of hand washing, lots of sanitizer. And in my head, I'm just sort of challenging things like, in our offices, we've got plastic screens, our perspex screens. We've got people wearing visors. And I suppose the challenge in my head is trying to get people to come off the fence and say what's right and what's not is difficult. Because we work in a bakery, it's quite hot, so thermal comfort is quite a challenge as well. So we don't have mandatory wearing of face masks because we try to stick to 2 metre social distancing. Our hygiene teams prefer to wear visors because you can sort of circulate the air. But then when I read recent information, it would suggest that visors aren't really any use whatsoever.
So visors aren't classed as a kind of PPE equivalent of a face mask. So whilst they obviously have some benefit in actually potentially reducing the chance of spread, they are not an equivalent of a face mask, and I'm using mask rather than covering because the two things do different jobs, of a face mask PPE. Where visors have been used is a kind of particularly an eye protection setting. So where people, you might see doctors with a face mask and a visor, and that's where there's some sort of aerosol generating procedure happening where there might be a risk of splashing in the eyes, because if we go back to the principles of this, it might help answer some of the questions. It's a respiratory virus that's spread through droplets predominantly. So either droplets coming face to face, that spread direct, or spread of a surface that's been contaminated that you then touch. And at the touch transmission, you have to touch the surface and then touch a membrane, a part of your eyes, nose, mouth, where that can then enter your system. So that's why in some settings visors are used as as an eye protection equivalent, where goggles could also be used. And so the visors, it's a bit, I wouldn't be saying to a doctor going into a clinic, a COVID clinic, to be wearing a visor rather than a face mask. It would be a face mask. It's one of those where that kind of protect, that visor, that barrier is providing some physical barrier, so maybe helping to reduce the spread in some ways, but wouldn't be classed as PPE to actually say that is more guaranteed, or definitely that appropriate risk mitigation. Does that make sense? I know it's not straightforward.
It does. I suppose my challenge is I've got a number of people, say in a dispatch operation, who pick products whose preference would be to wear visors, and the challenge in my head is, do I spend money on that because I'm looking at a range of controls, because I've got another question around sort of temperature checks, which again is one of our controls, and I've had a challenge from the business because I've spent money on a thermographic camera, so when people walk in they get an instant temperature check. It seems to give a level of comfort and to the people who stood in the camera and think I'm okay from a temperature point of view. But then the challenge is, you've spent how much on a camera, and I couldn't give a monkey's really. I'm doing what I think is safe and right, because if we ever had a conversation, not in this sort of nice environment, I want to make sure that if I do have a conversation with you sort of 3 months down the line, it's on the basis of, well, I know what levels of controls you put in, and how much you're sort of passionate about keeping the welfare of your people paramount, their safety.
So with temperature is one of the three key symptoms. So we've got high temperature, a new continuous cough, or a loss or change to smell or taste. And I think it's really important to keep reminding people of those are the three key symptoms. We do know that other symptoms are also often present, but those are the three key ones that one of constitutes somebody being symptomatic. So I can understand you using temperature check as a kind of a control measure. I think that's one way that people can then get their temperature checked. It's remembering that is one of three potential symptoms.
Brilliant. And I suppose the last one I've got, so apologies to everybody, is we're trying to educate people as well around those three areas, because again, as we're starting to come into autumn and winter, people are going to get colds like they do every year. And I suppose my challenge in my head is, how do I stop people from going for tests when they don't need to, but also then having people going for tests who do need to, which I think is the current challenge when I look at schools, because at the moment it just seems to be, you've got a sniffle, send them off. And I'm not surprised the system's sort of crashing, because I think there is people going who don't need to. So it's probably, how do we educate people in the workplace, but also probably how do we educate people within the region?
Well, we're doing what we can to get that message out, about what the symptoms are, and also what, the key principles to avoiding the risks of being exposed. I think it's a really good challenge. It's a really good question. It's going to be a challenge. I don't think there is a straightforward answer, otherwise we'd all be doing it. But I think it is going to be one that we live with through this winter. Some of that challenge of spotting the relevant symptoms, but as you say, many of those symptoms have overlaps with other illnesses, so it is a massive challenge in that respect.
And based on that, my question would be, how can we help?
Thank you. I think promote those messages, promote the principles. The more that we can get that message out about how COVID's transmitted, how it's more likely to spread, and what those risks are, the more that we can help people to adapt their behaviour. It's such a challenge. I'm not trying to say that this is an easy one to do. We are social beings, and we want to be close to each other, talking to each other. All of those things I absolutely understand, but that's exactly how respiratory illnesses are spread, and that's the challenge that we face at the moment until we have, you know, some other tools to help us manage the spread and the impact of this. So it is a huge challenge, but the more that we can change our behaviour to live with this and accommodate this, the less we're going to have like enforced measures of that distancing. So I suppose it's just the more we can change our behaviour, however hard that is, and it is with complete understanding of that I say this, but the more we voluntarily change our behaviour, the less we're going to have, you know, other measures put in that enforce that distancing. All of the booking, whilst we have sites in Stockport and a couple of them move around, but we have a couple of we have some fixed site as well. So we have testing sites available, but all of the booking is done through the national portal. So it's either ringing 119 or logging on to nhs.uk/coronavirus, and you can be prompted to book a test through there. Situation. Okay. I think that's a really good question. It's one that we, you know, kind of debate a little bit. I think the first step would be to make sure that anybody with symptoms is isolating along with their household. So they should be advised to not come into the office. They should be advised to go straight home and isolate whilst they're waiting to book a test. And, you know, real understanding for how challenging that is at the moment in particular. The best thing to do would be to start thinking, what if this comes back positive? In those 2 days prior to that individual starting with symptoms, who have they been close contact with in that workplace? So that close contact definition is anyone you shared a car with, anyone who you've been face to face with, like, you know, close up face to face with for any period of time, anybody you've been within 1 metre of for a minute or more. So passing is different, but if you've been stood with somebody within a metre, that counts. And then anybody who you've been within 2 metres of for 15 minutes or more. And that is one of the fundamental things that we can all do to prevent being a contact, is stay 2 metres. So that, you know, that distancing is really important. So when you're thinking about the workplace, when you're thinking about the physical environment, keeping that distance will help reduce the number of people who are potentially in that close contact list, and therefore the number of people who are going to have to isolate as contacts. So I think the precautionary approach would be to ask those people who may have fallen into that list to be really careful about their activities until that result comes back, because if you imagine, if you work with it's going to come back positive, every onward contact that those contacts then have is a potential additional exposure. So a kind of let's be cautious approach would be a really sensible one at that point, until the positive test came back. We are in that position of if we acted on every if we acted with a full contact tracing approach on every single case, every single possible case until it came back positive, then you would be doing that, you know, non-stop, I'm sure. But I think that if you understand the principles behind what would happen with a positive case, I think it can help plan for and take precautionary steps to get that in place. I'd also have that list of people who you think are the close contacts ready, so that you can give that information to test and trace once that contact has come back positive. And even before that you had that contact with NHS test and trace, if you knew who those contacts in that workplace setting were, you could advise those people to then isolate.
Can I just ask a question, Jennifer, about care homes in Stockport and things like that, talking about the high increase in the rates, but when that filters into, the bad news at the end of that, I'm hoping that we're in a better place than maybe we would have been in March with things like protecting vulnerable people. And there's such a high percentage of those elderly people who are the ones who ultimately don't get through it.
Yeah.
So from a Stockport point of view, would we be hoping that although we're seeing much higher rates of cases, that the majority won't end up in severe?
Absolutely, we're doing absolutely everything we can. You know, there's loads of steps in place. There's loads of preventative approaches in place with our care homes. I think, you know, as the things go on, we have to take all steps to protect the vulnerable. You know, as this goes on, you know, there's going to be a few things needed. One is absolutely, as you say, protecting the most vulnerable. And I think having come through that first wave, we now know even more about who is most vulnerable. So we're you know, making strong plans at the moment about how we enact some of that. But we can't, unfortunately, this isn't going to be an either or situation. It's not going to be a protect the vulnerable or reduce community transmission. It's both. We have a population who are entirely vulnerable, if you like, in the sense to actually catching this. Obviously, there's people who are more vulnerable to becoming severely unwell or passing away from this. But we have a population who, you know, are at risk in that sense. We also don't know the full long-term health effects of having this. So we are seeing more and more evidence coming through about some of the negative health impacts of having this, even if you're slightly less vulnerable than actually passing away. So that's a bit of an unknown. So it's another risk why we can't really just let this sort of run. And then the other aspect is that we don't have an entirely segregated society. So we don't have a complete protection around those more vulnerable. We also, you know, whilst we've learnt loads, haven't we, in this last 6 months, we don't know the full extent of who is vulnerable. And, you know, there's still a lot of learning to do there. And also, you know, we've seen the impact on, so business continuity and those sorts of things as well. You know, as rates and levels rise. So I think we have to be doing everything we can to reduce that community transmission, that more general community transmission, as well as protecting the vulnerable. I don't see it as an either or, unfortunately.
No.